Have you been told you have spinal stenosis and immediately started wondering, will I need surgery? Is this going to get worse? Am I going to lose my ability to walk? If so, you're not alone. These are some of the most common and important questions patients ask after being diagnosed with spinal stenosis. You've probably searched online and found answers that are confusing, contradictory, and downright scary. The problem is that misinformation and fear often create more anxiety than the condition itself. In this video, I'll answer the 10 most frequently asked questions about spinal stenosis, explain what the symptoms really mean, and help you understand the treatment options available so you can move forward with confidence. And be sure to stay until question number 10, where I'll answer one of the biggest fears many patients have after receiving this diagnosis. Could stenosis eventually leave me dependent on a wheelchair? Hi, I'm Dr. Kevin Wafer, a chiropractor based in Houston, Texas. I help people overcome disc bulges, sciatica, stenosis, and chronic spinal issues without surgery or risky medications using chiropractic corrective care. This channel is for busy people who want real practical strategies to relieve pain, restore mobility, and prevent future flare-ups. Subscribe now if you want expert tips, simple exercises, and proven solutions that help you move better, feel stronger, and stay pain-free. Number 1, what is spinal stenosis? Spinal stenosis occurs when the space around the nerves in the spine becomes smaller, making it harder for those nerves to function normally. As the nerves become irritated or compressed, symptoms can develop in the lower back, buttocks, and legs. What makes stenosis confusing is that many people expect the biggest problem to be back pain, but often the legs tell the story more clearly. If you've noticed aching, cramping, burning, numbness, tingling, or a heavy feeling in your legs when you stand or walk, these symptoms may be coming from nerves that no longer have enough room around them. Several changes within the spine can contribute to this narrowing, including arthritis, bone spurs, thickened ligaments, and bulging discs. The important thing to understand is that stenosis is not just about what's on an MRI. It's about how the nerves respond to the available space and how that affects your ability to move throughout daily life. Once you understand that spinal stenosis is often a nerve problem more than a back problem, it becomes easier to see why some activities trigger symptoms, why others bring relief. Number 2, what are the common symptoms of spinal stenosis? The symptoms of stenosis can vary from person to person, but one of the most common patterns is discomfort that starts or worsens when you're standing or walking and improves when you sit down or lean forward. Many people notice aching, cramping, burning, numbness, tingling, or a heavy feeling in the buttocks and legs. Some describe it as a feeling like their legs are running out of energy. Others say they can walk only a short distance before they feel the need to stop and rest. If you've ever found yourself looking for a bench, leaning on a shopping cart, or bending forward for relief, those details often help explain what the nerves are experiencing during daily activities. Back pain may be present, but it's often the leg symptoms that are the biggest impact on daily life. The nerves traveling through the lower spine help control sensation and strength in the legs. And when the nerves become irritated, walking and standing often becomes more difficult than sitting. When spinal stenosis occurs in the neck, symptoms often look very different. People may notice balance problems, clumsiness with their hands, difficulty with fine motor skills, or pain, numbness, and tingling that travels into the arms. The challenge is that these symptoms often develop gradually, making it easy to dismiss them at first and blame them on something else. Number 3, what causes spinal stenosis? Stenosis develops when changes inside the spine reduce the space available for the nerves. Several structures can contribute to that narrowing, including bone spurs, thickened ligaments like the ligamentum flavum, bulging discs, and arthritic changes in the joints of the spine. Many people assume there must have been a single injury or event that caused it. In reality, spinal stenosis often develops gradually over time as the changes accumulate and begin taking up the space around the nerves. That narrowing may not cause symptoms right away. Problems usually begin when the available space becomes limited enough that the nerves can no longer tolerate certain positions or activities. If you notice that your back feels manageable while sitting, but your legs begin aching, cramping, burning, or feeling heavy when you stand or walk, the difference often tells us the nerves may be responding differently to standing and walking than they do when you sit. The issue is not necessarily that the legs themselves are the problem. The nerves supplying the legs may not have enough room to function comfortably under certain conditions. Less commonly, some people are born with naturally smaller spinal canal, and others develop spinal stenosis after trauma or previous spinal conditions. Regardless of the cause, the diagnosis of one does not tell the whole story. The real question is how much narrowing is affecting the nerves and your ability to function from day to day. Number 4, is spinal stenosis serious? The answer depends on how much the narrowing is affecting the nerves and how much it's impacting your daily life. Spinal stenosis exists on a spectrum. Some people have mild symptoms that are more of an annoyance than a limitation, while others find that walking, standing, shopping, traveling, or even getting through a normal day becomes increasingly difficult. One thing that causes unnecessary worry is assuming that a diagnosis of spinal stenosis automatically means severe disability is just around the corner. That's not how the condition behaves for most people. The severity of spinal stenosis is not determined by the name of the diagnosis alone. It's determined by how the nerves are functioning and whether the symptoms are progressing over time. If you can still do many of the activities you enjoy, but you're noticing that your legs fatigue more quickly, become numb, or feel heavy after standing and walking, that does not necessarily mean permanent damage is occurring. It does mean that symptoms deserve attention and should be evaluated appropriately. What concerns doctors most is when symptoms continue to worsen, walking ability becomes increasingly limited, or neurological changes such as weakness, balance problems, or loss in function begin to appear. Those situations require closer attention because they can influence treatment decisions moving forward. Before I answer question number 5, I want to point you to some additional resources that may help if you're dealing with spinal stenosis symptoms right now. On my channel, you'll find videos covering exercises to relieve spinal stenosis pain, seated mobility exercises, gentle morning routines, ways to build stronger legs so you can walk further, and common mistakes that keep symptoms coming back. I've also covered why leg pain often gets worse the longer you stand or walk, what it can mean when your legs start to feel weak or give out, and some of the most common misconceptions that prevent people from making progress. If you're looking for practical strategies to improve mobility, reduce pain, and better understand what's contributing to your symptoms, I put together a spinal stenosis playlist that brings those videos together in one place. You'll find a link to the playlist in the description below. Now, let's continue because the next topic is one that often answers a lot of questions people have after they receive a diagnosis. Number 5, how is spinal stenosis diagnosed? Diagnosing stenosis starts with your symptoms, not the MRI. While imaging is important, doctors first want to understand what you're experiencing and how those symptoms affect your daily activities. If you've noticed that standing and walking trigger pain, numbness, cramping, or heaviness in your legs, but sitting down provides relief, those details can be extremely helpful. The pattern of symptoms often tells us as much as the severity of the symptoms themselves. During an examination, your doctor will evaluate strength, sensation, reflexes, balance, and walking ability. The goal is to determine whether the nerves are being affected and how much they may be contributing to your symptoms. An MRI is usually the most useful imaging test because it allows us to see the spinal canal, the nerves, discs, ligaments, and areas of narrowing. However, one of the most common misconceptions is that the MRI alone provides all of the answers. It doesn't. You may have significant narrowing on an MRI and have relatively mild symptoms. You may also have symptoms that affect your quality of life, even when the imaging findings appear less severe. That's why doctors combine your history, examination findings, and imaging results before making treatment recommendations. Once the diagnosis is confirmed, the conversation usually shifts from understanding the problem to figuring out what can actually be done about it. Number 6, what are the best treatments for spinal stenosis? The best treatment depends on your symptoms, how much they're limiting your daily activities, and how the nerves are responding. For most people, treatment does not start with surgery. It starts with conservative options designed to reduce pressure on irritated nerves, improve mobility, and help you return to activities that have become difficult. One of the biggest mistakes people make is focusing only on pain. The larger goal is helping you stand longer, walk further, and regain confidence in your daily movement. If you've stopped taking walks, avoid longer outings, or find yourself searching for places to sit because your legs start aching, cramping, or feeling heavy, treatment should focus on improving those limitations. Common treatment options include physical therapy, flexion-based exercises, anti-inflammatory medications, epidural steroid injections, chiropractic adjustments, and non-surgical spinal decompression. Flexion-based exercises are often helpful because many people with spinal stenosis feel better when bending slightly forward. Chiropractic adjustments may help improve mobility in restricted joints and reduce stress on surrounding structures, and spinal decompression may also be considered in certain cases to help reduce stress on the affected nerves. What often surprises people is that successful treatment is not always about changing what the MRI looks like. The goal is improving nerve function, walking tolerance, and and quality of life. Many people are able to make meaningful progress with the right combination of conservative treatments before surgery ever becomes a consideration. Number 7, can physical therapy or chiropractic care cure spinal stenosis? Physical therapy and chiropractic care can be very effective parts of a treatment plan for stenosis, but it's important to understand what most people mean when they use the word cure. Neither treatment physically removes bone spurs, thickened ligaments, or other structures that may be contributing to narrowing within the spinal canal. What these treatments can do is help improve how your body functions despite those changes. Physical therapy often focuses on improving strength, flexibility, mobility, and walking tolerance. Chiropractic spinal adjustments may help improve motion in restricted joints and reduce stress on surrounding structures. The goal is to help the nerves function more comfortably and improve your ability to perform daily activities. That distinction is important because many people focus entirely on what the MRI shows. Meanwhile, what they really want is to walk further, stand longer, and have fewer symptoms in their back and legs. If you've reached a point where leg pain, cramping, numbness, or heaviness is limiting your activities, improving function often matters more than changing the appearance of the scan. Many people experience meaningful improvement through physical therapy, chiropractic care, or a combination of conservative treatments, even though the narrowing itself may still be present on the MRI. Number 8, is walking good for spinal stenosis? Walking is generally one of the best activities you can do for your overall health, and in most cases, people with spinal stenosis should continue walking as much as their symptoms allow. The challenge is that spinal stenosis often makes prolonged walking more difficult because of how certain positions affect the nerves. Many people notice that the longer they walk upright, the more their legs begin aching, cramping, burning, feeling numb, or becoming heavy. If that sounds familiar, there's a reason for it. Walking fully upright places the lumbar spine into more extension, which can further reduce the space available for already irritated nerves. As that space becomes more limited, symptoms often become more noticeable. This is why many people find they can walk further when leaning slightly forward on a shopping cart. The same principle applies if you stop and lean forward on a park bench, countertop, railing, or other stable support. For many people, that forward-leaning relief position temporarily reduces stress on the nerves and allows symptoms to settle down. Instead of trying to push through worsening symptoms, it's often better to take frequent breaks and use those relief positions when needed. Walking remains important, but understanding how to walk with spinal stenosis can make significant difference in how far you're able to go and how comfortable your legs feel afterwards. Number 9, when is surgery necessary for spinal stenosis? Surgery is usually considered when conservative treatments have not provided enough relief and your symptoms continue to significantly affect your quality of life. For most people, surgery is not the first step. It becomes part of a conversation when walking, standing, daily activities, and overall function continue to decline despite appropriate treatment. Many people assume that a diagnosis of spinal stenosis automatically means surgery is inevitable. That simply is not true. I've worked with many people who are able to manage their symptoms successfully through a combination of exercise, physical therapy, chiropractic spinal adjustments, non-surgical spinal decompression, activity modifications, and other conservative treatments. The decision becomes more serious when symptoms continue to progress. If your walking distance is getting shorter, your legs are becoming increasingly weak, or you're finding it harder to perform normal daily activities despite following the treatment plan, surgery may be needed to be considered. Surgery may also be recommended when neurological symptoms are worsening. Progressive weakness, significant balance problems, loss of coordination, or other signs of nerve dysfunction deserve prompt medical attention. The goal of surgery is not simply to fix an MRI finding. The goal is to create more space for the affected nerves and improve function when conservative treatments are no longer providing enough benefit. For many people, understanding when surgery is appropriate is often less frightening than wondering if they will eventually lose their independence. Number 10, will I end up in a wheelchair? This is one of the biggest fears people have after being diagnosed with spinal stenosis, especially when they start noticing leg pain, numbness, weakness, or difficulty walking. The good news is that for the vast majority of people, the answer is no. What often happens is that people begin searching online, read worst-case scenarios, and assume that any change in their walking ability means they're headed toward permanent disability. In reality, stenosis usually progresses gradually, and many people are able to maintain their mobility and independence for years with the right treatment approach. If you've noticed that your walking distance is decreased or your legs feel heavy after standing for too long, that does not automatically mean you're losing the ability to walk. More often, it means the nerves are becoming irritated under certain circumstances. Understanding what triggers your symptoms and addressing them appropriately can make a meaningful difference. The most important thing is not to ignore symptoms that are getting worse. If you've noticed increasing mobility limitations, leg weakness, balance changes, or worsening nerve symptoms, addressing them early often gives you a better chance of maintaining function, staying active, and preserving your independence. Today we covered the 10 most frequently asked questions about spinal stenosis, including what causes it, the symptoms to watch for, how it's diagnosed, best treatment options available, when surgery may be necessary, and whether spinal stenosis can eventually lead to a wheelchair. My goal was to help you better understand what is happening inside of your spine so you can make informed decisions and feel more confident about managing your condition. The biggest takeaway from this video is that a diagnosis of spinal stenosis does not determine your future. What matters most is how the condition affects your function, how early you address the symptoms, and whether you take the right steps to keep moving, stay active, and protect your independence. Looking back at what we discussed, which topic helped you the most? Was it understanding the best treatment options for spinal stenosis, or learning when surgery is actually necessary? Drop a comment below and let me know. If you found value in this video, please give it a like and share it with someone dealing with spinal stenosis. Doing that helps more people find practical, non-surgical solutions that may help them move better and feel better. And if you want more videos that help you better understand what is actually causing your pain and what you can do about it, make sure you subscribe to my channel. Now, if you'd like to learn 5 simple seated exercises that can help relieve spinal stenosis pain and improve flexibility, go watch this video next. I'll show you movements that are often easier to tolerate for stenosis patients and explain how we help patients move more comfortably, walk further, and stay active with less pain.